Hello friends, in our online course in telemedicine and teleconsultation, we will be dealing with our first video module, and that is based on the introduction to telemedicine and teleconsultation. First, by WHO, we will see what is the definition of telemedicine. According to World Health Organization, telemedicine is the delivery of healthcare service where distance is a critical factor and all healthcare professions using information and communication techniques for the exchange of valid information for diagnosis, treatment and prevention of disease and injuries, research and evaluation, and the continuing education of healthcare workers with the aim of advancing the health of individuals and communities. So this is the definition of telemedicine by WHO. Again, the WHO has given the definition of telehealth. Telehealth is also the delivery and facilitation of health and health related services including medical care, provider and patient education, health information services and self-care via telecommunications and digital telecommunication technologies. So this is about the telemedicine and teleconsultation. As all of you know that we are living in a techno world. Now the time has come, we have to go for the teleconsultation. Today we are in the pandemic situation of corona. Everybody is at lockdown situation, and in such a situation it's very difficult to break the chain of corona. For breaking the chain of corona and also for the treating the patients, this telemedicine has its own importance and it plays a very vital role. In healthcare services, there is primary healthcare, secondary healthcare and tertiary healthcare. Now all this healthcare is seen by the doctors, but now because of shortage of doctors and overcrowding of the population and patients, now it's not possible for each and every doctor to attend all primary and secondary cares. So telemedicine will help to get rid of these problems. Telemedicine will help to treat the primary and secondary healthcare systems, and only patient has to take a last stop in the hospital in case of only tertiary care. In telemedicine, we can do the telemedicine with the newer advanced tools, and this telemedicine will help the patient and doctor for teleconsultation, also from doctor to doctor for the expert opinion, for the doctor to institute to have the institutional opinion of a expertise doctor. And many times in case of many chronic cases, for example psoriasis and diabetes mellitus and vitiligo, and in non-emerging cases, telemedicine and tele-expertise opinion is very useful. So in this era, now we have to live with the telemedicine and online e-consultation therapies. Telemedicines, in the mode of communication of telemedicines and the technologies used in the medicines, telemedicines can be done by the video chatting. Patient can do the directly video chat with the consult doctor. He can share his problem, he can show his pictures, and accordingly teleconsultant doctor can advise him the medication. This telemedicine is also done by the pictures. Patient can share his pictures, and looking at the visual diagnosis of that picture, doctor can give the proper care or proper information to the patient. Telemedicine can also be done by the audios, and telemedicine can also be done by the text. So telemedicine can all be done by videos, audios and text based by WhatsApp, SMS, fax and mails. So in this new era, one must expertise in both online telemedicine and offline physical examination for the management of disease. So nowadays the world has become very small. We can consult a patient from America, we can consult a patient from other different countries, and we can take opinion of an expertise doctor in America. This is all possible because of teleconsultation and telemedicine. So now we have to live in an era of telemedicine. Telemedicine is done by the doctor with the patient, by the caretaker with the patient doctor, by the health worker with the registered medical practitioner, by registered medical practitioner to registered medical practitioner. One doctor can take the teleconsultation with the expert doctor, and in case of emergency cases, we'll take a few examples of that. If some patient need a physiotherapy exercises and the physiotherapist is not available in his town, so he may consult the physiotherapist in a higher town. He can share his problems with that physiotherapist, and after having the video of that patient, physiotherapist can demonstrate some videos and tell the patient to do those video exercises, and by this teleconsultation he can advise him the physiotherapy. And in other case, for example, you take a case of a dermatologist. If some patient is suffering from a fungal infection, he is not knowing what is the fungal infection, but he can consult a dermatologist. He can send his pics to that dermatologist. Dermatologist will diagnose the case in the video or pictures, and he can give the proper medical treatments. So telemedicine now it is used in each and every part of the country. Now the world is becoming very small. If some patient want to consult a patient living in a distant remote area or in Andaman Nicobar, he want to consult an Australian expertise doctor, he can consult him, he can take his opinion by telemedicine. So nowadays telemedicine is a part of life, and now we have to live with the telemedicine, because now we are facing one after another some pandemic situations in our world. So this corona pandemic situation tells us to use more and more telemedicine in our medical practice.